Good morning. I'm Lynda Kelley. I'm with the United States Department of Agriculture, Food Safety Inspection Service. I'm at the Eastern Lab in Athens, Georgia, and I'm happy to be able to talk with you this morning about the diseases of ruminants. We'll discuss lesions that are seen in cattle, sheep, and goats. I'd like to take a minute to thank my colleagues in veterinary pathology for sharing their slides with us today. I appreciate the sharing from the veterinarians, the veterinary medical officers in the plants for Food Safety Inspection Service. They've been very helpful about submitting lesions for us to evaluate. Also, the veterinarians that are my colleagues at Food Safety Inspection Service, the International Veterinary Slide Bank, the National Correlation Center, and universities throughout the world. Could I have the first slide, please? Now, do we advance? Okay. First, we'll discuss lesions of the bovine heart and pericardium. This is an example of white muscle disease. Myocardial degeneration, mineralization, and necrosis are most common in the subendocardial myocardium of the left side of the heart. This area undergoes the greatest intramyocardial tension during systole and is therefore most likely to show lesions of ischemia. White muscle disease, as we've got illustrated here, is due to a microangiopathy associated with a vitamin E selenium deficiency. And I think you can appreciate the paler surfaces in the myocardium here in these areas, the white streaking. As we discuss causes of myocardial degeneration, many of these are similar in gross appearance and varied etiologies, so I'll go through and show you examples of several different etiologies, but they may have a similar morphologic appearance. This also is white muscle disease, and I think you can appreciate in this one we have areas of mineralization or calcification in the subendocardium. The little white flecks here are calcium as well as areas of necrosis. This also is an example of white muscle disease. You can appreciate the lighter discoloration, areas of degeneration that we have in the myocardium. This is myocardial degeneration and necrosis due to coffee weed or cassia. Other plants that accumulate fluoroacetate include gastrolobium and oxalobium. This is multifocal myocardial degeneration and necrosis due to monensin. It's an ionophore that's used as a coccidiostat in poultry and a growth promotant in ruminants. It's more commonly a problem in horses and pigs because ruminants can handle the monensin better, but it's a dose-related phenomena. So when there are problems with mixing of the feed, we do see this as a lesion in ruminants. This is an example of gossypol toxicity. We see this in calves. You can see the areas of myocardial degeneration and necrosis. Gossypol comes from soybean meal extract. It's a toxic principal there, and it's only causes a lesion in monogastrics. So we only see this in calves and sheep before the rumen is developed. This is an example of eosinophilic myositis. Sometimes you'll see just diffuse white streaking. Here this is a later lesion where you've had a mineralization and granuloma formation. So eosinophilic myositis can have several different appearances, and this is more the granulomatous appearance that you'll see. Again, eosinophilic myositis. Many times you'll see more of a green discoloration with eosinophilic myositis, but this is important in the stage of the disease. Early on, there are quite a bit of eosinophils in the lesion, which give it the greenish discoloration. But as the lesion ages, there's more fibrosis, more lymphocytes and plasma cells, and fewer eosinophils. So you'll have more of a granulomatous appearance with a white discoloration of the myocardium. This is an example of myocardial malignant lymphoma. Lymphoma involving the heart can be nodular, as you see here. It can actually be on the surface of the heart, multiple nodules of malignant lymphoma. Or you can see just a diffuse infiltration of neoplastic lymphocytes invading between skeletal muscle fibers just to give it a pale discoloration in the heart. And all of these are malignant lymphoma, and as you can see here, this appearance can resemble some of the myocardial degenerations. If you see lesions in the atrium of the heart, right atrium, malignant lymphoma needs to be at the top of your rule like this, because this is a classic location for malignant lymphoma. This is granulomatous myocarditis. This particular example is due to hairy vetch toxicity. This is a focal area of infarction and subsequent abscess formation due to necrobacillosis or Fusobacterium necrophorum. This is an example of blackleg or gangrenous or necrohemorrhagic myocarditis due to Clostridium shovii. Here you can appreciate the necrohemorrhagic tracts that are present in the myocardium. This is an example of xanthosis or brown atrophy of the heart. This is more normal myocardium, and this is xanthotic myocardium. Ruminants are principal animals affected by atrophy. The atrophic heart rarely produces clinical signs, but you can see the demonstration or the deposition of the lipofuscin pigments, and as the heart shrinks in size, you can actually see wrinkling of the endocardium. These are neurofibromas involving the heart. They're typically very shiny, very glossy in appearance, nodular formations, and this is the typical distribution of neurofibromas in the heart. Here you can see on cut surface, they're very shiny, very glistening, a little bit more wet or shiny in appearance than you'll see with malignant lymphoma, although that would be a good rule out for this lesion. Neurofibromas can also involve the valves of the heart. And this is another example of neurofibroma involving the AV valves. Hemangiosarcomas of the bovine heart can involve the valves, and another common location for hemangiosarcoma of the heart is in the right atria. This is an acute, diffuse, fibrinous epicarditis. Causes of fibrinous pericarditis in cattle with or without hemorrhage would include sporadic bovine encephalomyelitis, contagious bovine pleuropneumonia. Pasteurellosis would be the most common cause. Blackleg, clostridial hemoglobinuria, and neonatal coliform infections stemming like from navel ill or other septicemias. This is a diffuse, severe fibrinopurulent pericarditis and epicarditis, like you might see with hardware disease or traumatic pericarditis. This is a more acute fibrinohemorrhagic epicarditis. Here you can see serous atrophy of fat, and this is a common location to find in the epicardial fat. As the lipocytes lose their lipid vacuoles, they are replaced by proteinaceous fluid, and that's what gives fat this gelatinous appearance. Etiology is due to wasting diseases or starvation, as they have to mobilize their body fat stores for energy. Here you can appreciate serous atrophy of the fat on the epicardial surface in conjunction with lipofuscinosis, the pigmentation and the brown atrophy of the heart. This is subendocardial mineralization and calcification. It's associated commonly with prolonged debilitating diseases in cattle, cattle, most notable Johne's disease. You'll see subendocardial mineralization in lambs associated with nutritional myopathy. It's more commonly located in the right ventricle. You can also have subintimal mineralization with the wasting diseases. Here you can see the aorta has plaques. A little bit closer up you can appreciate how these plaques of mineralization actually extend into the vascular cavity. This is a chronic vegetative valvular bacterial endocarditis. Valvular endocarditis in cattle usually is bacterial in origin. In cattle, the most common cause would be Actinomyces pyogenes, and also streptococci of enteric origin are common causes. In lambs, the enteric streptococci would be most important. Again, a chronic, proliferative, or vegetative valvular endocarditis. You can appreciate the proliferative arrangement here. It's actually occluding part of the ventricle. And this example is due to Haemophilus somnus, much more hemorrhagic and aggressive, a little more acute in appearance. Serous cysts of the valves are very common in cattle, adult cattle, whereas the hematocysts are more commonly seen in young calves. This is a subaortic ventricular septal defect, which of the congenital heart defects is a common one in cattle. Here you can see a patent foramen ovale. Epicardial hemorrhages are common in cattle and can often be caused just by agonal change. This is a more extreme example of epicardial hemorrhage that's associated with a thrombocytopenia. These are lesions of cysticercosis bovis. You can see where actually the cysts have become granulomas in the myocardium. The larva of the human tapeworm Taenia saginata is responsible for causing these lesions. Humans acquire the infection when they consume inadequately cooked beef or veal, so that's why we're concerned about them in food inspection. Next we'll go to lesions of bovine skin. This is an example of a cutaneous horn. You can appreciate the keratinized plaques. Here we have cutaneous horn that's surrounding the teat on the mammary gland. This is cutaneous papillomatosis. Can become quite severe, can affect the head and the neck and the anterior parts of the trunk most commonly. Here's an example of cutaneous papillomas around the eyelids. This is trichophyton mentagrophytes, the most common cause of dermatomycoses in cattle. The lesions are, you'll see the gray, white, rough, hairless lesions. So you've got a diagnosis of multifocal alopecia and hyperkeratosis. This is an example of pediculosis or lice. Dermatophilus congolensis is a bacteria that cannot penetrate normal skin, so it's associated with prolonged wetting of the skin and mechanical damage. The bacteria extend through the epidermis, but they never are able to go through the basement membrane. So as the bacteria cause lifting of the epidermis, you'll get regeneration of the epidermis. Bacteria will infiltrate the new epidermis. These will lift as well, forming ulceration, and you get a hyperplastic superficial dermatitis with crust formation. So this is a very typical appearance where you'll see separation, a lot of crust formation here, layers of epidermis and bacteria separated from the basement membrane of the skin, but it never extends down into the dermis. This is Staphylofilaria stolacei. Typically, it forms circular patches in the skin of the ventral midline. A morphologic diagnosis for this would be chronic, multifocal to diffuse proliferative dermatitis. Etiologic diagnosis would be dermal, staphylophilariasis. This is ichthyosis. A morphologic diagnosis would be to severe epidermal lamellar hyperkeratosis. The pathogenesis would include enhanced corneocyte cohesion. I think you can appreciate these plaques of keratinocytes that stay together. This is an example of aspergillosis in an aborted fetus. So this would be a multifocal mycotic dermatitis. This is epitheliogenesis imperfecta, a lack of the epidermis and the dermis. It's a congenital defect. This is an example of copper toxicity, fading of the pigment, and alopecia. It's the only significant pigmentary disorder of the skin in food animals. You see depigmentation. This is an example of photosensitization. The most common cause of photosensitization in cattle would be hepatogenous. The phytoerythrins, which is the photodynamic agent, is released from chlorophyll by microbes in the GI tract of the herbivores. Phytoerythrins are normally excreted in bile, but any cause of severe cholestasis for more than a few days can result in accumulation of the phytoerythrins and resulting in photosensitization. Here I think you can appreciate that the only affected skin is the white skin, and as the dark skin has been spared. Ingestion of fluorescent compounds such as hypericin and St. John's wort can also cause photosensitivity. A third cause would be aberrant endogenous metabolism, such as with bovine protoporphyria or congenital porphyria of cattle. Of course, the pathogenesis for this one would be deficiency of uroporphyrinogen cosynthetase. Photosensitivity can actually be quite severe. Here you can see actually ulceration. So a deep, focal, severe ultrahemorrhagic dermatitis. This is mycobacteriosis, subcutaneous granulomatous dermatitis due to Mycobacterium leprae, flavum, avium. Many of the atypical bacteria are responsible. The only reason it's significant in cattle is that it causes a positive response to M. bovis testing, tuberculosis testing. This is malignant lymphoma. I think you can appreciate the subcutaneous nodules. And of course, this form, the sub-Q form of lymphoma, is not associated with bovine leukemia virus. This is an example of a melanoma in cattle. Typically, melanomas in cattle tend to be malignant more often than in horses. It's a more aggressive disease. This is an example of periocular squamous cell carcinoma. Squamous cell carcinoma is a very significant economic disease of cattle. Typically, it's found in the white haired areas of the face. We see it on like Hereford or white-faced black cattle. This is another example of squamous cell carcinoma of the eyelids. We also see squamous cell carcinoma that's associated with thermal brands. So just like the UV light affecting the white skin of the Hereford tends to be a promoting factor in squamous cell carcinoma of the skin, branding, the thermal injury there, tends to play a role. We don't see squamous cell carcinoma associated with freeze branding. This is an example here. We have a proliferative squamous cell carcinoma. And in this case, I think you can appreciate where there starts to be proliferative activity or neoplastic transformation actually associated with the bran in an early lesion. And here we have the squamous cell carcinoma. This is subcutaneous eosinophilic granulomas associated with larvae of the warble fly Hypoderma lineatum or Hypoderma bovis. This larvae migrates to the back after a period of residence in the adventitia of the esophagus. And of course, if you see it from the flip side, you'll actually be able to see the pore breathing hole of the warbles. This is gangrenous pododermatitis or ischemic necrosis. There can be several etiologies for this gangrenous pododermatitis. One is fescue foot. Would be named the disease would be fescue foot. It's cattle grazing on tall fescue that's infected with the endophyte fungus Acromonium coenophalium. Another etiology would be ergot poisoning, where the fungus Claviceps purpurea develops in seed heads of many grasses, produces toxic alkaloids. When these alkaloids are ingested, they cause direct stimulation of adrenergic nerves supplying the arteriolar smooth muscle, causing a marked peripheral vasoconstriction and therefore ischemic necrosis. This is an example of BVD, where you get a coronitis. Blue tongue disease causes hyperemia of the coronary area. Blue tongue can also cause ulcerative lesions on the teats. This is a granulomatous dermatitis and alopecia due to hairy vetch toxicity. Next, we'll go to lesions of the bovine digestive tract. First, I'll talk about diseases that cause oral vesicles or ulcers in cattle and sheep. Since many times these diseases can look identical, I'll show you some examples and tell you what diseases cause them, but first I'll discuss what the different rule-outs or your disease differentials that I would have when you see oral ulcers or oral vesicles in cattle and sheep. Foot and mouth disease causes oral ulcers of the oral mucosa, gingiva, and tongue. Of course, we don't see it in this country other than in Plum Island, but it's important, of course, in other countries. In sheep with foot and mouth disease, you'll see oral lesions throughout the cavity, but the dental pad tends to be a preferred site. Vesicular stomatitis, which is a rhabdovirus in the genus Vesicularvirus, causes oral lesions in cattle. Sheep and goats don't appear to be susceptible to vesicular stomatitis. Bovine virus diarrhea, mucosal disease of the genus Pestivirus, causes oral erosions. One characteristic lesion is blunting of the papilla on the buccal mucosa that you'll see with bovine virus diarrhea. Malignant catarrhal fever causes oral lesions. Blue tongue doesn't cause vesicular lesions, but it causes erosions and ulcerations. Blue tongue is a reovirus of the genus Orbivirus. It affects sheep, goats, and cattle. Bovine papular stomatitis is a parapox virus. Typically causes very punctate, rounded lesions. Infectious bovine rhinotracheitis is a bovine herpes virus, type 1. And these lesions are punctate with a slightly raised margin. And it's typically seen in neonatal calves with GI disease because IVR typically causes more respiratory lesions. This is an example of vesicular stomatitis causing an ulcerative glossitis. Vesicular stomatitis can also cause ulcerative lesions on the gums, the lips, the gingiva. This is malignant catarrhal fever with a necrohemorrhagic rhinitis. It also causes an ulcerative stomatitis. This is malignant catarrhal fever causing an ulcerative glossitis. And again, you can see the ulcerative lesions due to malignant catarrhal fever on the hard palate. This is an example of blue tongue, which also can cause a necrohemorrhagic rhinitis. This is bovine papular stomatitis, and I think you can appreciate the very characteristic punctate lesions. This is multifocal ulcerative glossitis due to BVD. This is oral necrobacillosis caused by Fusobacterium necrophorum. Wherever it occurs, it's a secondary invader following mucosal damage. Once Fusobacterium necrophorum is established, it proliferates, causing extensive coagulative necrosis. It's best known as causing calf diphtheria, causing lesions in the pharynx and the tonsils. But this is where it can develop sort of a nidus here, where you've had injury around the teeth. So that would be a focal necrotizing stomatitis or gingivitis. This is gondylonema pulchrum. You can see it in the oral cavity as well as in the esophagus. It's a spiroid nematode, and it remains in the stratified squamous epithelium of the upper GI tract in ruminants and in swine. Doesn't cause any clinical problems. This is an example of gingival actinomycosis, very similar to necrobacillosis. Gets its origin here where there's injury to the gingiva and starts to proliferate. And this is what causes the lumpy jaw as it gets down into the bone around the periosteum. This is an example of enamel hypoplasia. Ameloblasts are sensitive to fluoride and some viruses such as BVD. Fluorosis characteristically shows loss of enamel more severely on the corner teeth, and so you can appreciate the dark discoloration due to the loss of the enamel. And again, here we have the enamel hypoplasia due to fluorosis, chronic fluorosis. This is Actinobacillus lignearsi. It's part of the normal oral flora, introduced into the submucosa. It causes a pyogranulomatous inflammation centered on club colonies called Splendori hepli, and they're grossly called sulfur granules. Etiologic diagnosis for this lesion would be lingual actinobacillosis. It's a disease of soft tissues. It can affect the tongue, mouth, pharynx, neck, even the walls of the forestomachs and the skin. Spreads along the lymphatics, and you can see it in lymph nodes and occasionally in the lung. Retropharyngeal and submandibular lymph nodes are most commonly involved. The morphologic diagnosis for this would be multifocal pyogranulomatous glossitis. Name the disease, wooden tongue. This is a close-up of the musculature. You can appreciate the little granulomas that are in the musculature, skeletal musculature of the lung. This is to show you different appearances. This is a cross-section of the tongue. You can identify it as tongue tissue because of the papillary projections coming off the epidermis of the tongue. And here are the pyogranulomas in the skeletal musculature. This is just a different presentation where the tongue has been slit from the ventral surface and opened up so that you can appreciate the pyogranulomas here. That also is wooden tongue. This is Cysticercus bovis. It's a common location to see Cysticercus in the tongue, and it's a place that our inspectors in the plants slit the tongue to try to identify carriers of Cysticercus bovis. This is papillomatosis of the esophagus. It's a papovavirus caused by bovine papillomavirus type 4. This is a fibroma that's nearly occluding the opening to the esophagus. Again, gondylonema pulchrum. We have linear ulcers and erosions of the esophagus. Causes of linear ulceration in the esophagus would include BVD mucosal disease, rinderpest, malignant catarrhal fever, toxins, and blue tongue. This particular one is due to blue tongue. These lesions, linear erosions and ulcerations of the esophagus, are due to oak bud poisoning. So that would be a multifocal ulcerative esophagitis. This is due to BVD. Again, you have the linear ulcerations. More circular lesions of the esophagus are seen with bovine papular stomatitis. And IBR and neonatal calves can cause circular lesions, irregular or linear. This is the bovine rumen. Here you can see mycotic ruminitis, areas of infarction of the rumen papillae. You can appreciate here a hyperemic rim around areas of infarction, and this is very typical of mycotic lesions. Mycotic lesions, when you're trying to differentiate those from necrobacillosis, the pathogenesis would be excess carbohydrate, rumen acidosis, change in rumen microflora, increase in strep bovis, therefore increased lactic acid. Then you have an increase in lactobacilli, which further causes a change in the pH. This acid environment causes a chemical ruminitis, injured mucosa. You get superficial necrosis of the mucosa. And at that point in time, the ruminal acidosis can contribute to lesions from necrobacillosis or from mycotic infarction of the rumen. Ways to differentiate grossly: the mycotic lesions are deep, they're more hemorrhagic. You'll see this red rim around them. They're more irregular in outline, and you see a vasculitis associated with them on histology. The mycotic lesions will go all the way through to the serosal surface, whereas Fusobacterium necrophorum is a more superficial lesion. This is an example of malignant catarrhal fever causing multifocal ulceration of the ruminal pillars. This is a fibropapillomavirus, bovine papillomavirus 2, so the causing the fibropapillomas in the rumen. This is ruminal candidiasis of a calf. You can appreciate the little white flecks of the candida colonies throughout the rumen. This is the reticulum. I think you can appreciate the normal honeycomb appearance of the rumen. This is a multifocal necrotizing reticulitis. This particular one is caused by malignant catarrhal fever. This is another lesion of the reticulum. You can see the honeycomb appearance, but here you've got mycotic irritation, mycotic inflammation. So it's a mycotic reticulitis caused by Aspergillus. Here we have the abomasum, and you can see edema and hemorrhage. This particular lesion is caused by arsenic, but you can see edema of the abomasum in many diseases that cause hyperproteinemia. This is an example of osteotagiasis in the abomasum. The morphologic diagnosis for this is chronic, diffuse, proliferative abomasitis. The nodules are formed because of mucous metaplasia. These animals have diarrhea and a hyperproteinemia. Here I think you can appreciate the nodular formations that are present in the abomasum due to osteotagia. Another classic lesion that's seen in the abomasum is brachy, which is caused by Clostridia septicum. It causes an acute abomasitis of lambs and calves, It's a sporadic disease of young animals, usually in cooler climates. The abomasal folds are thickened, reddened, hemorrhagic, or necrotic. And I think you can appreciate the edema, gelatinous edema, and emphysema, the little bubbles here in the submucosa. Again, you can appreciate the hemorrhage, the edema here, and the emphysematous gas bubbles that are formed. That's Brachy, Clostridium septicum. Malignant lymphoma of the abomasum causes a diffuse thickening of the wall of the abomasum. These are abomasal ulcers. They're common in young calves. We see about 50% of the bovine calves that come to slaughter are affected by abomasal ulcers. Dairy cows and a smaller number of feedlot animals also have these type of ulcers, and we think they're associated just with stress. Here you can see the focal ulceration. Commonly you'll also see edema and hyperemia of the abomasal mucosa. So you would want to have those in your morphologic evaluation as well. This is another perforating abomasal ulcer with the areas of erosion around that, and congestion and hemorrhage, and this would be associated with at least a localized chronic fibrinopurulent pericarditis. This is mycotic abomasitis. I think you can appreciate, just like we saw in the rumen, where you have the areas of hemorrhage and hyperemia, around areas of necrosis and infarction. This is another mycotic abomasitis. This is an example of malignant catarrhal fever causing multifocal necrotizing abomasitis. This is necrobacillosis in the abomasum. Here you can see you've got multifocal necroulcerative areas throughout the abomasum, but they don't have the characteristic red rim, and they don't appear to be full thickness infarction. They're more of a superficial lesion. In the small intestine, we typically see a serofibrinous peritonitis that goes along with the E. coli enteritis. You can see here the serum, fibrin accumulation, some hemorrhage along the serosal surface. If you look at the lumen of the gut, you can appreciate that there is an erosive fibrinohemorrhagic enterocolitis. This is due to enterohemorrhagic E. coli. They secrete a virotoxin. Another lesion which is quite similar is caused by salmonella. There's a fibrinonecrotic enteritis. Many times it'll form a diphtheric membrane. Another classic lesion of the bovine small intestine is caused by Mycobacterium paratuberculosis. The name of the disease would be Johne's disease, or some people prefer to call it paratuberculosis. Morphologic diagnosis for this would be diffuse granulomatous enteritis. Sheep and goats are also susceptible to paratuberculosis, but you don't see quite the thickening of the small intestine, and they typically will have a wasting disease but no diarrhea like you would see in cattle. Here I think you can appreciate the tremendous thickening of the ileum. And on the serosal surface, many times you can see this thickening cord-like appearance of the lymphatics, where you actually get a granulomatous lymphangitis as well. This is a normal Peyer's patch in the ileum of a cow. And this is the site that you will see that's most affected by BVD. You'll get a focal acute necroulcerative enteritis of the Peyer's patches. Of course, you can see diffuse or multifocal necrosis of the rest of the intestine as well, but it's more pathognomonic when you see the necro-ulcerative areas in the Peyer's patches. Here again, necro-ulcerative inflammation of the ileum, of the Peyer's patches. Here we have a diphtheric membrane that's still intact. This is an example of M. bovis peritonitis, Mycobacterium bovis. With Mycobacterium bovis enteritis and peritonitis, you'll see more mineralization, and it's more nodular than the appearance of Johne's disease in cattle. This is malignant lymphoma involving the lymphoid tissue of the small intestine and diffuse lymphadenopathy. Okay, in the large intestine, Salmonella causes a diffuse fibronecrotic typhlocollitis. Of course, Salmonella can take on many different morphologic appearances. Animals that are quite sick clinically can have nothing more than just a slight hyperemia of the mucosa. It can range to a fibrinous typhlocollitis to where you have severe necrohemorrhagic ulceration of the mucosa with diphtheritic membrane formation. This is Trichuris, the whipworm in the cecum. The spiral colon of ruminants is much like the abomasum. It's another site that when you have hyperproteinemia in the animal, it will accumulate a lot of edema. So this is edema of the spiral colon. This lesion is due to esophagostomum. The morphologic diagnosis for this would be multifocal subserosal intestinal granulomas. Coccidiosis in cattle can be quite severe. The two most common pathogenic coccidia in cattle are Eimeria zernii and Eimeria bovis. Eimeria causes necrosis in the colon and in the cecum. A morphologic diagnosis for this lesion would be a diffuse fibrinohemorrhagic typhlocollitis. As you can see here in the rectum, the amount of hemorrhage in these lesions can be quite severe. This is another case of coccidia in cattle. This is BVD, or causing a multifocal ulcerative colitis. Here I think you can appreciate intussusception of the cecum into the colon, sort of a bread loaf shaped organ as it goes into here, the hemorrhage and necrosis of the base of the cecum. Mesotheliomas are common in the peritoneal and pleural cavity of cattle. They're sort of proliferative, glistening nodular lesions. Granulomatous, chronic multifocal granulomatous peritonitis can give a somewhat similar appearance. This is an example of fat necrosis that we see in cattle. We particularly have a problem with this with cattle in the southeast that are grazing on fescue pasture. The same endophyte that I mentioned earlier, acromonium, is also responsible for fat necrosis. This is the one that caused the ischemic necrosis or the gangrenous pododermatitis. This acromonium also causes fat necrosis in cattle. Clinically, we see problems where, as you can see here, this fat necrosis can occlude the GI tract. So we see problems with digestive tract problems, also problems with dystocia when this hardened fat blocks the birth canal. The fat tends to be like a white opaque color rather than more of a clear, and it's mineralized and it has sort of a soapy appearance to it. So this is typical fat necrosis. This is an example of nodular exocrine hyperplasia in the pancreas. This is very common. It's sort of an aging lesion in cattle, similar to what you have in dogs. Next, we'll go to lesions of bovine skeletal muscle. This is an example of white muscle disease in cattle. It's caused by selenium vitamin E deficiency. In lambs, it can be a little bit more difficult to diagnose because they have very pale muscles anyway. But in sheep, you're more likely to have mineralized lesions. So look for calcified flecks in the muscle to differentiate grossly. Cattle and sheep are more susceptible than goats to white muscle disease. When skeletal muscle lesions predominate, the large muscles of the thigh and shoulder can have very extensive lesions. Since many of the causes of degenerative myopathy, degeneration and necrosis are similar, just like we talked about in the heart, we'll show some examples and I'll try to show you how you can differentiate between those morphologically. And for example, the white muscle disease I mentioned is bilaterally symmetric. When you get ischemic necrosis of the muscle, such as we have in downer cattle, more typically you'll see congestion in adjacent areas of the muscle. And if you think about the pathogenesis of ischemic necrosis with downer cattle, this makes sense. Pathogenesis would be that the pressure within the muscle caused by the weight of the body on them may rise to levels higher than both the venous and the arterial pressure. The intramuscular pressure collapses the veins, then you develop congestion, then the pressure is high enough to collapse the arteries and you get edema and then the ischemic necrosis. Ischemic necrosis in downer cattle tends to have a very sharply delineated border. Here you have the pale areas that are ischemic, then the congested muscle. This is another example of an ischemic necrosis due to pressure necrosis. And again, you can appreciate fairly well delineated borders. One last example of this ischemic necrosis of the muscle and the congestion in the adjacent skeletal muscle. This is eosinophilic myositis, and this is sort of a classic textbook case where you have the green discoloration. Fairly early lesion, probably with a lot of eosinophils. Later on in the disease, as you get more necrosis with mineralization, you'll see how you start to see sort of more granuloma formation and you start to lose some of the greenish discoloration, just a pale color. This is a chronic lesion of eosinophilic myositis, where actually it just looks more like a white, firm granuloma formation. But this also is eosinophilic myositis. Other myopathies, just as we discussed in the heart, that can cause degenerative lesions would include gossipal in calves and lambs, cassia or coffee weed, and Ruminants. This is an example of a multifocal granulomatous myositis of the brisket. We see this because Johne's disease vaccine is usually given in the brisket muscle. And again, this is a multifocal granulomatous myositis due to Johne's vaccine. This is to show you normal muscling in bovine skeletal muscle. You can see the fat in the fascia, and then a small amount of the fat deposited in the muscle. This is a good example of steatosis, where the fat has been deposited within the skeletal muscle, giving it a light appearance of sort of white streaking to the muscle. And of course, this would be something you need to differentiate from multifocal degenerative changes in the muscle. Apparently, the endomysial cells, which retain the ability to differentiate into fat cells. So for some reason in some cattle, they differentiate into fat cells, and that's what gives you the increase in fat. This is just a more severe example here where the muscle's being replaced by fat cells. It's not a clinical problem, it's just a problem that we face in meat inspection, differentiating this from areas of degeneration. This is malignant lymphoma in skeletal muscle. This lesion happens to be fairly discrete and well differentiated, but just as in the heart, malignant lymphoma can have a nodular appearance, but also neoplastic individual cells can migrate between skeletal muscle fibers, just causing a lightening of the muscle in areas. This is an injection site in the muscle. A morphologic diagnosis for this would be focal, necrotizing, and granulomatous myositis. This is another injection site. We see these typically in slaughter animals. This is necrohemorrhagic or gangrenous myositis. Etiology for this is Clostridium shovii. Name the disease, blackleg. An etiologic diagnosis would be clostridial myositis. Next, we'll go to lesions of bovine kidney and urinary bladder. This is an example of pyelonephritis. I think you can appreciate where the lobules are not always uniformly involved. It may be more severe at the poles. Another example of pyelonephritis. And on cross-section of the kidney, you can appreciate where there is an irregularity to the calyces. You have accumulation of the purulent material and involvement if you have an ascending infection going through the medulla up into the cortex of the kidney. This is an example of an embolic nephritis, a hematogenous spread rather than an ascending infection. This particular embolic nephritis is caused by an acute salmonella septicemia. You can appreciate that the kidney is swollen and the capsular surface glistening in appearance. On cut surface, you can see areas of hemorrhagic infarction and glomeruli, these little petechial hemorrhages throughout the cortex. We see this as a problem not only in calves, as reported in the literature, but also in adult cattle and slaughter. I guess the stress of shipping and all, many times you can have a salmonella septicemia in adult cattle as well. This is another example of an embolic nephritis. This one is caused by E. coli. This would be considered the white spotted kidney. And I think you can appreciate some similarity to this and what we saw in malignant lymphoma of the kidney. So this would be another rule out when you see a kidney with this morphologic appearance. You would say malignant lymphoma would be a rule out. Also white spotted kidney would be another. Causes of embolic nephritis in cattle would include adult cattle. Probably the most common one would be Actinomyces pyogenes. In sheep and goats, Corynebacterium pseudotuberculosis. And of course in calves, E. coli. Next we'll go to chronic interstitial nephritis. And I think you can appreciate here, in chronic interstitial nephritis, there's an irregularity to the capsular surface, and you can appreciate the rays of inflammation and fibrosis that extend from the capsular surface down into the medullary area. I think when we come back, we'll start with granulomatous nephritis. In our discussion of lesions of the bovine kidney, next we'll cover causes of granulomatous nephritis. This is an example of hairy vetch toxicity. You can appreciate multiple granulomas throughout the renal cortex. Multifocal granulomatous nephritis. This is multifocal granulomatous nephritis due to aspergillus, mycotic nephritis. This is an example of hydronephrosis. Got an enlarged, swollen kidney, and also hydroureter. Here you can appreciate the dilated calyces, atrophy of the renal medulla, And here you've got two morphologic diagnoses. There's a hydronephrosis, but also there's fat necrosis of the perirenal fat. And this is what contributed to the obstruction of the ureters and was the causative agent of the hydronephrosis. This is an example of hemoglobinuric nephrosis. One cause in cattle would be bacillary hemoglobinuria, where Clostridia hemolyticum is present in the liver in a spore form. We have injury from fasciola hepatica, release of the spores, and massive hemolysis. Here I think you get appreciation of the dark discoloration. Some tubules are even more affected than others. This happens to be due to hemoglobinuria, but also a myoglobinuric nephrosis would have a similar appearance. This is an acute nephrosis due to acorn toxicity. The acorns, the leaves, and the buds of oak shrubs and trees can all cause this type of lesion. The toxic substance is gallotannins. They cause perirenal edema and nephrosis, and also perirenal hemorrhage. Apparently the binding of the tannins to the endothelial cells is what causes the endothelial damage. So you can appreciate the kidneys are swollen and pale, and the cortex is sprinkled with 2 to 3 millimeter hemorrhages. This kidney is not quite as pale, but it is swollen, hemorrhagic, and you can appreciate the edema and the hemorrhage surrounding the kidney. That's a fairly classic lesion with acorn toxicity, the perirenal edema and hemorrhage. This is a more chronic nephrosis, and it's due to oxalates. Oxalates can get in the diet of ruminants from several sources. One from plants is halogeton and oxalis. Sourdock is what caused this particular oxalate nephrosis. The granularity can be that you'll actually have crystals retained in the kidney. Grasses such as Soteria also accumulate oxalates, and fungi such as Aspergillus niger or Aspergillus flavus. If there's fungal infection or infestation in the feeds, this can contribute to an oxalate nephrosis. This is an example of renal infarction, multifocal necrohemorrhagic infarction. Lesions of coagulative necrosis produced by embolic or thrombotic occlusion of the renal artery are one of its branches. A morphologic diagnosis would include acute to subacute multifocal renal cortical ischemic necrosis. Here you can appreciate the hemorrhagic rim. This one may be a little bit older because the centers are starting to become deheglomatized. An acute infarction will be bright red throughout. Older areas of infarction will have paler centers as the hemoglobin is lysed. Again, a multifocal hemorrhagic infarction of the kidney. And in cross-section, it's nice when you can appreciate this wedge shape where you've had a blockage of the arcuate artery and then hemorrhagic necrosis of the renal medulla and of the cortex. Renal cysts are common in cattle. There are at least 3 mechanisms that I know of that will cause renal cysts. Probably the most common that we see in adult cattle is obstructive lesions, like secondary to scarring of the renal interstitium. You can also have renal cysts secondary to changes in the tubular basement membrane, causing dilatation of the tubules, and also a disordered growth of tubular epithelial cells. And we do see cysts in kidneys that are associated with renal carcinoma, and there I think those cysts are due to disordered growth. Another example of the renal cysts that are localized in the cortex. And sometimes the cyst can be so large even as to be larger than the kidney was originally in size. With polycystic kidney disease, you'll see multiple small cysts, and they can involve the cortex and the medulla. And in humans and in calves, there's been an association of polycystic kidneys with cystic bile ducts, bile duct proliferation, and sometimes also pancreatic cysts. This is an example of amyloidosis causing the pale discoloration of the cortex. Amyloid can be both cortical and medullary in cattle. One type you'll see amyloidosis just of glomeruli, and you'll see like a proteinuria associated with that. But also amyloid commonly surrounds intertubulary capillaries, both in the cortex and in the medulla. The main thing you'll see is you'll have an enlarged, pale, swollen kidney. And there's sort of a soapy or waxy appearance to the kidney. One thing that's helpful to me in evaluating cross-section with amyloidosis is to me it appears that the cortex is much thicker in relation to the medulla than you would see in a normal kidney. And here I think you can appreciate some fine granularity to the cortex. It would also represent amyloid in the glomeruli. But of course here, these streaks here, you can see we've got quite a bit of amyloid in the intertubular areas and some in the medulla as well. This dark discoloration of the kidney is due to lipofuscinosis. You'll get the brown granules in the epithelial cells of the proximal convoluted tubules. This is lipidosis in the kidney. In cattle, commonly you can see accumulation of lipid droplets in the proximal convoluted tubules of the kidney. So this would be another rule out for an enlarged pale kidney that has a distended or an thickened cortex. So lipidosis and amyloidosis would both be two rule outs to consider. This is malignant lymphoma in the kidney. You can have very discrete, well-localized lesions of malignant lymphoma. They can be multiple and involve the medulla and the cortex. Or they can be, here you can see fairly localized lesions, but here you see sort of just a light discoloration of the renal cortex. This is malignant lymphoma as well. So just as we saw in the heart or the skeletal muscle, in the kidney you can also have diffuse, well-delineated lesions. Diffuse lesions or well-delineated nodular lesions, and they're both malignant lymphoma. This is an example of malignant lymphoma, and I think you can appreciate the similarity here to white spotted kidney disease in calves. So when you've got these white diffuse nodular lesions in the renal cortex, then I would have white spotted kidney or malignant lymphoma as two of my rule outs. This is an example of a renal adenoma. They characteristically, the carcinomas and the adenomas, protrude from the capsular surface. They commonly can involve one of the poles of the kidney. And I think you can appreciate this yellow to orange color. In cattle, we found that renal carcinomas can often be multiple and bilateral and still be primary renal carcinomas, even though grossly they would have the appearance of a tumor metastatic to the kidneys. Urolithiasis is common in cattle. I think you can appreciate some of the urinary calculi right here at the face of the renal papillae. This is a fetal kidney, well formed but just very infantile, small in size. This is pulpy kidney disease caused by enterotoxemia type A. You see a soft, swollen, hemorrhagic kidney. Next we'll go to diseases of the bovine urinary bladder. This is a diffuse necrohemorrhagic cystitis. Here we see multifocal hemorrhagic cystitis with edema. This was secondary to a salmonella infection. You can appreciate the swollen edematous bladder multifocal petechial hemorrhages. This is an example of enzootic hematuria. Okay, the lesions in the bladder of cattle that are due to the chronic ingestion of bracken fern. And there does appear to be a link between bracken fern ingestion and the bovine papillomavirus in the development of bladder neoplasia. The classic lesion that you see in the bladder with enzootic hematuria are these nodular hemangiomatous type lesions. You'll get dilatations of vessels in the bladder, and then they'll proliferate. But you can see many other tumors in the bladder with exposure to bracken fern. Other types of tumors would include transitional and squamous cell carcinomas, papillomas, adenomas, the hemangiomas and hemangiosarcomas, as we mentioned, leiomyosarcomas, fibromas, and fibrosarcomas. You can also get multiple tumors of more than one type at the same time in the kidney, and you can get mixed neoplasia. And this is an example of emphysematous cystitis, and you can appreciate the protrusion of the bladder mucosa due to emphysematous gas bubbles below the mucosa. Next, we'll go to lesions of bovine liver and gallbladder. This is acute congestion in the liver. You can appreciate swollen, rounded edges. This cross-section of liver exhibits chronic passive congestion, or what has classically been called nutmeg liver. The periacinar necrosis seen in passive venous congestion, the necrotic cells are usually replaced by stagnant pools of blood. The periacinar raised surviving hepatocytes are often filled with lipid, and so they're raised from the front surface, and this is what gives you this sort of nutmeg pattern. Here again, I think you can appreciate the periacinar pattern of the fatty hepatocytes, and then the pools of blood. So that's chronic passive congestion. This is an example of what's been called cirrhosis in the liver. If I were going to put a morphologic diagnosis on this lesion, I would call it a chronic multifocal hepatic fibrosis with nodular regeneration, or cirrhosis. This is hepatic lipidosis, a diffuse fatty liver. You can appreciate the liver is swollen, the edges are rounded, and the light discoloration. Physiologic fatty liver occurs in late pregnancy and heavy lactation, particularly in ruminants. You'll also see it with ketosis, starvation, and toxicities. This is an example of diffuse lipidosis. You can also see focal lipidosis beneath the capsular surface that's due to capsular adhesions when there's tension. And some people call this tension lipidosis because when there's tension on the capsule, we think that there's a relative anoxia in the tissue just below where the capsule is causing compression. So a morphologic diagnosis for this would be subcapsular focal fatty chains associated with capsular adhesions. Now there's also another morphologic diagnosis here. Note the telangiectasis in the rest of the liver. This is green liver disease, and it's associated with an accumulation of 2,8-dihydroxyadenine. For some reason, there's disruption of the metabolism of adenine, and we first identified this in a plant in Wyalusing, Pennsylvania, but now it's been cited in different plants throughout the United States. This can be a congenital defect, but it could also be caused by toxins that would affect metabolism of this. At the present time, we don't know what the cause of green liver disease in cattle is, but we do know it's associated with accumulation of the 2,8-dihydroxyadenine. And this sort of lime green color of the liver is very typical. This again is the green liver disease, and you can appreciate a pattern where it accumulates the crystals in the hepatic sinusoids. This is melanosis of the liver, a common change in the liver of cattle, sheep, and goats. Hepatic keratinosis gives the liver this typical orange appearance. Sometimes it's a little bit lighter too, more of a yellow-orange color, but that's hepatic keratinosis. Liver flukes can cause severe liver pathology in cattle. Fasciola hepatica migrates in the bile ducts. It causes a cholangiohepatitis. The biliary changes occur in all the lobes, but are typically more severe on the left lobe of the liver. When you're looking at the capsular surface of the liver, the bile ducts can stand out as firm white branching cords because of the ectasia. And I think you can appreciate the deposition of the iron pigments, iron porphyrin pigment, associated with the liver flukes. So this is fasciola hepatica. Now, lesions from liver flukes that are actually within the liver parenchyma and not in the bile ducts are caused by fascioloides magna. And fascioloides magna will produce large necrotic tunnels while migrating, and then you can also form large cysts in the hepatic parenchyma. So I think you can appreciate here these migrating tracts with the iron porphyrin pigments. And again, this would be like a multifocal necrotizing hepatitis with iron porphyrin pigment deposition associated with fascioloides magna. And this is the liver fluke, fascioloides magna. This is chronic, focal, or multifocal purulent hepatitis or necrosuppurative hepatitis. Hepatic abscesses are common in cattle, and they may arise by direct implantation with a foreign body from the reticulum. They can also be caused by hematogenous spread from the portal emboli, such as you see with rumen lesions, ulceration of the rumen mucosa, or you can get direct extension from it like a navel ill in a calf. This is necrobacillosis. I think the lesions with Fusobacterium necrophorum are fairly typical because they are raised from the surface, but they're not rounded like you'd see with a granuloma or an abscess. It's sort of like a flattened plateau. So even though they're raised from the surface, it's still sort of a flat top to the surface. A morphologic diagnosis for necrobacillosis would be multifocal hepatic necrosis or necrotizing hepatitis. Sometimes you'll see these lesions where they're old enough that the centers will liquefy and you can get a more typical abscess appearance. Like I mentioned, the etiology is Fusobacterium necrophorum. This is another example of necrobacillosis in a bovine liver. The typical, they're fairly circumscribed, irregular in shape, and a raised but still flat surface. This is a multifocal granulomatous hepatitis. It's associated with Mycobacterium bovis infection. Telangiectasis is very common in slaughter cattle. It's a parenchymal defect which reflects loss of hepatocytes, that space is then occupied by expansion of the adjacent sinusoids. Here in necropsy cattle, you can see where there's the dark areas where blood is accumulated on cut surface. You can appreciate that. In slaughter cattle, where they're bled out, the telangiectasis, the blood's lost, so you'll actually see little depressed areas on the capsular surface. These are both telangiectasis. Here you can appreciate the dark discoloration. These are more probably acute lesions. Here you can appreciate the pooling of the blood. Here you're starting to have loss of the hepatocytes. And that's telangiectasis, or sawdust liver. This is an example of hepatic thrombi. This is a septic thrombus that's secondary to endocarditis. Bile duct adenomas or adenocarcinomas are typically multiple, so you can get multicentric development of tumors within the bile ducts. This is an example of malignant lymphoma in the liver. You can have discrete nodular lesions. In this particular case, you'll have diffuse involvement of the liver where the neoplastic lymphocytes fill in the hepatic sinusoids, and I think you can appreciate the sinusoidal pattern of malignant lymphoma in this case. Now we'll go to lesions of the gallbladder. This is a necrohemorrhagic cholecystitis. The etiology in this particular case was arsenic intoxication. Here we have an acute hemorrhagic cholecystitis. This was due to a Salmonella septicemia. This is an example of gallbladder edema. This is an adenoma of the gallbladder. Has been associated with high levels of mycotoxins in the feed. Here, this is a cyst adenocarcinoma of the gallbladder. You can appreciate here, there's the liver and the neck of the bladder to the gallbladder, and the diffuse proliferation, neoplastic proliferation of the mucosa of the gallbladder. These focal areas represent squamous metaplasia of the mucosa of the gallbladder. Next, I'd like to talk about lesions of bovine bones and joints. This is an example of osteopetrosis. No matter whether it's accumulation of primary or secondary spongiosa, you will see this accumulation of the spongy bone filling the bone marrow cavity. That's very typical of osteopetrosis. The other thing that you'll notice is how narrow the diaphysis here. It almost makes it look like the metaphysis is too wide, but it's because you've got a very sharp narrowing of the diaphysis. So those are the two things you look for to make a diagnosis of osteopetrosis. It's seen in calves and in sheep, and most are inherited as an autosomal recessive trait. Osteopetrosis is caused by a defective osteoclastic resorption of mineralized tissue. That's either due to decreased numbers or efficiency of the osteoblasts, or an abnormality of the tissues being resorbed. And in cattle, we think now that this lesion is due to an abnormality in osteonectin. This is an example of rickets in the ribs of calves. Characteristic things that you'll see in rickets are you'll see a widening of the growth plate, a thickening of the cartilage, also the irregular growth plate. And the other thing that you can see is like this rib is almost a normal shape, but most of them exhibit this very widening or flaring of the metaphysis that's characteristic of rickets because you don't have the remodeling of the bone. You also have a lack of vascular invasion in these thickened cartilages. This is an example of congenital porphyria. Pathogenesis should include deficiency of the enzyme uroporphyrinogen 3 cosynthetase. The abnormal porphyrinogen intermediates accumulate in tissues and are readily oxidized to porphyrins that are capable of absorbing UV light and emitting visible fluorescence. And as we mentioned earlier, this is one of the ways that you can get a photosensitivity of the skin. In the bone, it gives you this, of course in the teeth they call it pink teeth, but a lot of times the bone has more of a brownish discoloration, but it can be the pinky brown. You can appreciate here the dark discoloration of the bony cortex. And of course, if you put the bone under a Woods lamp, you can get this great, pretty pink fluorescence, which is diagnostic. Okay, this is an example of osteomyelitis, so the physes, where you see the thickened areas. And in young animals particularly, this is a great location because of the way that the vessels have an end point at the physes. So many times if there's a bacterial septicemia, the bacteria will be localized right at the growth plate. So that would be physeal osteomyelitis. This is a picture of lumpy jaw. We get this tremendous proliferation of the bone of the mandible. And again, you can see how large this actually can be. It's caused by Actinomyces bovis. Lumpy jaw would be the name of the disease. Actinomyces bovis is a gram-positive branching filamentous organism that causes mandibular osteomyelitis. And the osteomyelitis usually stems from this original lesion here where we have a periodontitis. The gingival ulceration gives the bacteria nidus a focus that it can begin and gain a foothold in the jaw. This is vertebral osteomyelitis, and the main cause that I know of in cattle and in lambs is Actinomyces pyogenes. Here I think you can appreciate with the vertebral osteomyelitis, you get a softening of the bone and a compression of the bone with fracture. And as you can see here, many times you'll get compression of the cord causing clinical signs. We'll look at some causes of arthritis. This is a chronic ulcerative arthritis with eburnation of the bone underlying. This is an acute fibrinosuppurative arthritis, typical of what you'd see associated with a septicemia in calves. Here, you'd need to appreciate you got a proliferative synovitis associated with the arthritis in this case. This is, of course, arthrogryposis. There's several causes for that in calves. Probably the best documented has been ingestion of wild lupines between days 40 and 70 of gestation. And in fact, name the disease lupinosis would be one etiologic diagnosis. A deficiency of manganese has caused arthrogryposis in cattle, also in sheep and goats. And also acorn ingestion by pregnant cows can cause arthrogryposis in the fetus. In lambs, skeletal deformities have been caused by Verotrachum californicum, locoweed, such as astragalus and oxytropus, and also ingestion of parbendazole in the dam at 12 to 14 days of gestation. This is another example of arthrogryposis, or the twisted, hypercontracted joints. In lesions of bovine brain and spinal cord. The first disease I'll talk about is thromboembolic meningoencephalitis. It's caused by Haemophilus somnus, which is a normal microflora of the respiratory tract. Haemophilus somnus causes vasculitis, thrombosis, and infarction of the brain. Here you can appreciate that you've got a multifocal Necker hemorrhagic encephalitis with thrombosis. Now typically with embolic septicemic lesions in the brain, you'll appreciate that emboli will lodge right at the border between the gray and the white matter, such as these two right here. But for some reason with Haemophilus somnus, it doesn't necessarily stick with that. They can be a lot more random in distribution. So you'll see infarctive lesions in the white matter, anywhere in the gray matter, but occasionally we'll see a few at the border here. This also is a lesion of thromboembolic meningoencephalitis, and here the lesions are a little bit older, so you have a brown color to the infarcted lesion rather than the red hemorrhagic, more acute lesions. And you can typically see both in the same brain. This is an example of necrobacillosis, emboli to the brain. And necrobacillosis, or Fusobacterium necrophorum, can result in dry infarcts that have a similar appearance to the thromboembolic meningoencephalitis we just looked at. But more typically, necrobacillosis results in abscesses in the brain, such as we see here. This is an example of Listeria monocytogenes. It's most severe, the lesions in the medulla and the pons, but you can also see lesions in the thalamus and the cervical parts of the spinal cord. So you can appreciate these yellow areas of focal malacia, and also you'll see little multifocal areas of hemorrhage associated with the vasculitis of Listeria. Etiologic diagnosis would be listerial encephalomyelitis. This is polioencephalomalacia. You can appreciate the softening and the variability in the thickness of the gray matter of the cortex, and this yellow discoloration is somewhat typical when you have the poliomalacia. It's seen in cattle, sheep, and goats, and it's a lesion similar to what we see in salt poisoning in swine. What's actually reflected here is a laminar cortical necrosis of the gray matter. And in chronic cases, you can actually see sort of a separation of the gray and the white matter in the cortex. Polioencephalomalacia is caused by a thiamine deficiency or a disturbance in thiamine metabolism. You can actually have thiamine deficiency in the diet, or they can be exposed to thiamine antagonists such as amprolium. There are thiaminolytic enzymes present in the rumen that can cause a breakdown of thiamine. And also out west we see high amount of sulfur compounds both in the diet and in the water, and in conjunction they will cleave thiamine into pyrimidine and cause a relative thiamine deficiency even when there's adequate thiamine in the diet. Again, in polioencephalomalacia you can see a relative thinning of the cortex. This is normal coloration of a bovine brain. Here you can appreciate the pink coloration of the brain and dilatation of the capillaries caused by Babesia bovis. It's very common to see melanosis of the dura of the brain in cattle, sheep, and goats. This is an example of hydrocephalus, a congenital one in calf, where you actually see the domed forehead, the changes in the bony cavity. Here we have dilatation of the cerebral hemispheres. And in hydrocephalus versus porencephaly, you'll still see the ependyma lining the cavities. Here you can appreciate the cerebral cortex and a relatively sparse amount of cerebellum, so we have a cerebellar hypoplasia. The etiology of this commonly in cattle would be in utero bovine virus diarrheal infection or a blue tongue infection. This abscess in the brain, you can appreciate where the abscess is enlarged and compressing the hemisphere, is caused by Actinomyces pyogenes. This is a suppurative meningitis. You can see accumulation of the purulent material here at the base of the brain. It's secondary to a septicemia. Here we have a more acute hemorrhagic meningitis. This is a medulloblastoma. They're fairly rare, but this is a characteristic lesion. When you see a tumor in the cerebellum of a calf, they're also found in dogs. That's a medulloblastoma. This is an example of lissencephaly, where you can appreciate the lack of folds as compared to the more normal in the cerebral hemispheres. Here we have malignant lymphoma of the spinal cord. And again, a focal lesion of malignant lymphoma, and a common cause of Downer cow, where you have posterior paresis due to compression on the spinal cord. This is a meningioma. Can also cause compressive lesions of the spinal cord. Melanosis is common in the spinal cord of cattle, sheep, and goats, just as it is in the brain. This is syringomyelia, where you have a tubular cavitation of the spinal cord. This is an example of malignant catarrhal fever, where you have an ophthalmitis, inflammation of limbic vessels causing corneal edema and degeneration of epi and endothelial cells, sort of a bluish discoloration of the cornea with corneal edema. This is an example of a focal ulcerative keratitis. The name of the disease would be infectious bovine keratoconjunctivitis. And we do now know that it's caused by Moraxella bovis. Moraxella bovis, as we know, can be a normal inhabitant of the bovine eye. But there's a pathogenic Moraxella bovis that is a hemolytic, leukocytolytic, pileated strain of Moraxella bovis. And it has been found in eyes with these ulcers, whereas only the non-hemolytic, non-pileated strain is found in the normal bovine eye. Now, many times mycoplasma or infectious bovine rhinotracheosis can exacerbate the lesions and may also be found in infectious bovine keratoconjunctivitis, but Moraxella bovis is the key pathogen. This is just an example of a chronic keratitis which can occur as a sequela to the infectious bovine keratoconjunctivitis. This is a bovine dermoid, corneal dermoid. It's a congenital lesion of the cornea or conjunctiva with focal skin-like differentiation. So technically it's really a choristoma, but this is a typical location right here at the limbus. It's just seen sporadically in cattle, but there has been one report of high incidence in one herd of polled Herefords. This is an example of a corneal papilloma, or more likely here this is an in situ carcinoma, so they can originate on the cornea. Squamous cell carcinoma can also involve the third eyelid. So it can start on the cornea, can start on the sclera, can start on the third eyelid, or as we saw before, it can involve the skin of the eyelids. So that's squamous cell carcinoma periocular. Here you can see hypopigmentation of the iris that's associated with Chidiac-Higashi disease of calves. Next we'll go to bovine spleen. Lymphoma in the spleen can be very circumscribed nodular lesions where there's neoplastic involvement of the lymphoid follicles. Malignant lymphoma can also cause just a diffuse splenomegaly. And here you can see this is a spleen from a cow that had malignant lymphoma compared to the normal spleen. And it's not just due to congestion. Here you can see the meaty appearance of the spleen. Splenic infarcts are very common. You can have both the dry appearance here of a multifocal splenic infarction. You can also have splenic infarction with a hemorrhagic appearance. You can see hematomas of the bovine spleen, I'd be hard-pressed to differentiate this grossly from that picture of malignant lymphoma we saw a minute ago. Hemangiosarcomas are seen in the spleen of cattle. The orange discoloration here is characteristic of mast cell tumors that you can see in the spleen of cattle. Splenic abscesses are common in cattle. This would be a multifocal pyogranulomatous splenitis. Here there are multiple mesotheliomas on the capsular surface of the spleen. This is an enlarged spleen as compared to the normal bovine spleen. So we have a diagnosis of splenomegaly. One of the more common causes that we see in the Southwest is anaplasmosis. Other blood parasites such as babesiosis and trypanosomiasis can cause the splenomegaly. Anthrax, congestion, malignant lymphoma, and probably a more common cause that we see is salmonellosis, can also cause a splenomegaly. Next we'll go to lesions of bovine lymph nodes and hemal nodes. This is granulomatous lymphadenitis. This particular lesion is due to Mycobacterium bovis, which is a problem in slaughter cattle. Again, you can see sort of this diffuse granulomatous lymphadenitis. This is very characteristic of an appearance of Mycobacterium bovis. But within bovis, you can also see more discrete granulomas within the lymph node. A liver from Johne's disease or paratuberculosis, lymph node could have a similar appearance. This is Actinomyces bovis, which also causes a granulomatous lymphadenitis. Actinobacillus ligniersi. Now both of these, Actinobacillus ligniersi and Actinomyces bovis, as well as Staphylococcus or Botryomycosis, all three can form granulomas in lymph nodes. And sometimes you can appreciate the sulfur granules, the Splendori-Hepley bodies, which can be present, but sometimes you just see the granulomatous lesions. This is a hemorrhagic lymphadenitis. See areas of hemorrhage, but the lymph node is also swollen and edematous. This is a suppurative lymphadenitis. The lymph node is swollen. There's some blurring of the architectural lines between the cortex and the medulla, and you can appreciate the purulent material accumulating in the sinuses. Multifocal hemorrhages of the lymph node are common in cattle. Can be an agonal change, but it also can be evidence of a septicemia. Remember we talked about the green liver disease, accumulation of 2,8-dihydroxyadenine. We can see accumulation of the crystals in the hepatic nodes. Here's the background of the liver here. Hepatic node, we also see it in the renal lymph node. This is eosinophilic granulomatous lymphadenitis due to parasite migration. This is an example of malignant lymphoma, where you have a diffuse enlargement of the lymph node and a loss of the architecture. You can't really appreciate where the cortex and the medulla of the lymph node are. You've lost that separation, so that's your clue that you've got a neoplastic change in the lymph node. This is another example of malignant lymphoma in the lymph node. You can appreciate a complete effacement of the architecture by the infiltration of the neoplastic cells. Hemolymph nodes are common in the subcutaneous tissue of ruminants, cattle, sheep, and goats. They can be enlarged. You can have hyperplasia of hemonodes, and also malignant lymphoma can affect hemonodes. One cause that we've seen for marked dramatic hyperplasia of hemal nodes is anaplasmosis. First, we'll discuss causes of rhinitis. A necrotizing rhinitis. This example is due to IBR, which is a bovine herpes virus 1 that causes upper respiratory tract lesions, lesions in the trachea, and also in the conjunctiva. These are nasal granulomas. Morphologic diagnosis would be chronic multinodular granulomatous rhinitis. They can be caused by a chronic allergic, a hypersensitivity to a variety of plant pollens or fungal spores. Helminthosporum would be one etiology. Rhinosporidium seabrai is another. An infection with rhinosporidia has been associated with infected water sources. Another cause, not in this country but in India, would be schistosoma nasalis. This is another example of granulomas in the nasal cavity. This is a fibrinous laryngotracheitis caused by infectious bovine rhinotracheitis. This is a fairly acute fibrinous. Here it's more severe, a fibrinonecrotic. We actually have diphtheric plaques caused by diffuse necrosis of the mucosa of the trachea and larynx. Aspergillosis can be caused by trauma of the laryngeal folds, and you can get infection by Aspergillus. This is necrobacillosis, calf-hood diphtheria, or necrotic laryngitis. As we mentioned before, Fusobacterium necrophorum is an opportunistic pathogen. It requires mucosal damage before it can invade the mucosa and set up housekeeping. Predisposing lesions would include trauma, infectious bovine rhinotracheitis. Haemophilus somnus can also cause this lesion of calf diphtheria. In hemorrhagic diatheses, the larynx and trachea are a common place to see multifocal hemorrhages. Here you can see lungworms in the trachea, and here tremendous numbers of lungworms can fill the trachea in young calves with severe infections. Orientation, here's the vertebra. We're looking at the pleura. And this is a severe fibrinopleuritis, shipping fever. On the parietal pleura, you can also see a fibrinohemorrhagic pleuritis. This is a granulomatous pleuritis associated with infection with Mycobacterium bovis. This is what old-timers call Pearl's disease, because these granulomas are highly mineralized and do look like little pearls scattered on the surface of the pleura. Emphysema is common in the lungs of cattle. Here you have interstitial emphysema, where the interlobular septae are greatly distended by accumulations of air. Here we have bullous emphysema. This is a bronchopneumonia. You can appreciate the intraventral distribution. We've got collapse or consolidation of the lungs in these areas, more normal lung here. Multifocal purulent bronchopneumonias in cattle are caused by Pasteurella, more typically Pasteurella multocida, but occasionally Hemolytica, and Actinomyces pyogenes. This lesion is due to Pasteurella multocida. This is an example of actinomyces pyogenes. Again, the cranioventral distribution. Here you can appreciate the chronic bronchopneumonia and abscessation associated with actinomyces pyogenes. Now, the most common cause of bronchiectasis in cattle is a chronic bronchopneumonia. And this is a lung, collapsed lung, with atelectasis and marked bronchiectasis. Bronchiectasis is a permanent, abnormal dilation of bronchi. And in cattle, as I mentioned, it's almost always a sequela to chronic suppurative bronchitis or bronchopneumonia. You get a weakening of the bronchial wall by the neutrophil lysosomal enzymes being released, and also free oxygen radicals that are associated with the inflammation. And you get a pooling of exudate in the lumen, distending the lumen. In addition, with the bronchopneumonia, you have lower airway obstruction and atelectasis. And as you lose alveolar tissue volume, this is going to cause traction on the walls of the airways during inspiration, therefore dilating the bronchioles. So think again, here's bronchiectasis and also atelectasis of the lung tissue. Febrile or necrotizing pleuropneumonia. These are also bronchopneumonias, but they're caused by bacteria that are more fulminating, more highly virulent. You can occasionally see a pleuropneumonia with Pasteurella multocida. Characteristically, Pasteurella hemolytica is a lot more virulent and will cause the more pleuropneumonia where you have vascular damage, lesions on the pleura, and these can extend into what's called a lobar pneumonia. And the only difference between the bronchopneumonias and the lobar pneumonias is how aggressive, how virulent, how fast the bacteria are replicating, or how much toxins the bronchopneumonia bacteria are producing. With a lobar pneumonia, it's more typically Pasteurella hemolytica or Haemophilus somnus. This example, this is Pasteurella hemolytica. I'll just call this pasteurellosis, and you can appreciate the similarity between this lesion and the pneumonia that was caused by Pasteurella multocida. This is Pasteurella hemolytica, a bronchopneumonia that has turned into lobar pneumonia. You can appreciate the lobar distribution of the pattern in the lungs with consolidation of these lung lobes. Again, Pasteurella hemolytica. And with Pasteurella hemolytica, this is an example of a lobar pneumonia in the lungs of a cow. As I mentioned, a lobar pneumonia is a gross term which reflects a fulminating bronchopneumonia where the gross evidence of the bronchiolar orientation is not present. Typically, the lobar pneumonias are caused by highly toxigenic bacteria, such as Pasteurella hemolytica or Haemophilus somnus. The lobar distribution is caused by the vascular damage that these highly virulent organisms can cause. You'll see the leaking of the protein and edema fluid into the interstitial lobi, and they're so highly necrotizing that many times the necrosis can actually cross lobular septi, and that's what causes the lobar distribution when the whole lung lobe is affected. In addition, with the lobar pneumonias, because of the highly pathogenic bacteria causing vascular damage, you will see the pleuritis associated with these. This is a lobar pneumonia, or a febrile or necrotizing pleuropneumonia that's caused by Haemophilus somnus. This pneumonia is caused by contagious bovine pleuropneumonia, which is Mycoplasma mycoides, subspecies mycoides, small cell type. It causes a fibrinonecrotic pneumonia with marked serofibrinous pleuritis and widening of the interlobular septi. It's usually a bronchopneumonia or a lobar pneumonia. But you don't necessarily, you may also see affectation of the dorsal-caudal lung lobes as well, with contagious bovine pleural pneumonia. Next, we'll take a look at embolic causes of pneumonia, or bacteria with a hematogenous spread. Here you can see multifocal areas of hemorrhage and seeding of bacteria. This was due to a Salmonella septicemia in this particular case. Multifocal, suppurative, embolic pneumonia. This is an example of an embolic pneumonia due to mycotic organisms. This is Aspergillus, and of course it's probably secondary to ulcerative rhuminitis, an infarction of the rumen wall with the vasculitis, and the organisms gain access to the circulation, and then as a sequelae you'll see the mycotic emboli in the lungs. This is a mycotic granuloma in the lung. This is atypical interstitial pneumonia. Causes of acute interstitial pneumonia in cattle include the pasture-associated form. The etiology would be 3-methyl-indole and L-tryptophan. Other causes of interstitial pneumonia in cattle would include pyrrolament ketones, toxins from moldy sweet potatoes, the 4-ipomenol, stinkwood poisoning, and we've had reported cases from moldy garden beans. Also, the pyrrolizidine alkaloids from Crotalaria and Senecio, as well as causing liver lesions, can cause an interstitial pneumonia. With the interstitial pneumonias, you'll typically see this meaty, solid appearance to the lungs, and you can see interstitial edema. Again, you can appreciate these are proliferative pneumonias, and with interstitial edema or emphysema. When you're looking at the whole lung, the pleural surface, the lungs don't collapse upon exposure to the environmental air. They're very meaty, very solid. This is pulmonary thrombosis. This is pulmonary mineralization and calcification. You can see small areas of mineralization commonly in aged cattle, but when you see a diffuse mineralization like this, many times it's due to vitamin D intoxication or plant intoxication such as solanum. This is another example of diffuse pulmonary mineralization. Melanosis is common in the lungs of cattle, sheep, and goats. It's present on the pleural surface and also extends into the parenchyma. This area of dark discoloration is not melanosis. You can see where it's actually, there's a change in the architecture of the lung that's actually a proliferating nodule here in the necrotic tract. And this is due to liver fluke migration in the lung and the iron porphyrin pigmentation that's deposited. Adrenal tumors are very common in aged cattle. You'll see them associated with the anterior pole of the kidney. And on evaluating the capsular surface, I think it'd be very difficult to differentiate between a pheochromocytoma and a cortical adenoma or carcinoma. This happens to be a pheochromocytoma. And on the cut surface, I think you can appreciate there's a lot of vascular spaces with hemorrhage and necrosis, and also the sort of yellow-orange coloration of the tumor. And these are characteristics of pheochromocytomas in cattle. This is an adrenal cortical carcinoma, again at the pole of the kidney. On cut surface, they tend to be more of an even, homogeneous appearance. They don't have the cystic cavitations and areas of necrosis and hemorrhage that you see in the pheochromocytomas. Melanosis is common in the adrenal gland of ruminants. In the bovine reproductive tract, you can see hermaphrodites. This is actually technically a male pseudohermaphrodite. You can see the testicle. For a hermaphrodite, you have to have both types of gonadal tissue. In the pseudohermaphrodite, you can have one type of gonadal tissue, and then the rest of the genitalia. Here you can see the normal uterus with the testicle. And here again, another example of a male pseudohermaphrodite with the testicle associated. Here we have a persistent penile frenulum. These are granulosa cell tumors of the ovary, fairly common in aged cattle. Here you can appreciate these darker areas which reflect cystic spaces in the tumor. Here this is ovarian granulosa cell tumor with very large cysts here, and many of the tumors just have smaller cystic spaces and attached to the horn of the uterus. This is just an ovarian cyst. Paraovarian cysts are common in cattle. You see a variety of cystic structures that are located to the ovary. This orange structure here is a normal corpus luteum. After the ovary has passed the egg, then you'll have where this luteinizes and becomes sort of an orange color. This is a cystic corpus luteum, which can cause some reproductive abnormalities. The uterus is a common location for malignant lymphoma. With malignant lymphoma, typically you'll see the horns are enlarged, but a fairly smooth appearance to the surface of the horns. Whereas in uterine adenocarcinomas elicit a very serous reaction, and they typically will go from the mucosal surface and dive deep toward the serosal surface and cause a pitting and the scarring of the serosal surface of the uterus. This is another uterine adenocarcinoma, and you can appreciate the nodular irregularities of the surface. And actually, we can have tumor proliferation on the serosal surface of the uterus. This is a leiomyoma, or a smooth muscle tumor of the wall of the uterus. This is prolapsed cervix. Here we have an endometritis where the uterine horn is dilated, larger than normal, and you can appreciate the dilatation of the vessels. This is a suppurative endometritis. The most common cause of suppurative endometritis is actinomycosis and streptococcus. This is a granulomatous endometritis caused by Mycobacterium bovis. It's estimated that about 20% of all cows with generalized tuberculosis have involvement of the endometrium. And it's primarily a hematogenous infection. We'll move on to the placenta. Infarction of the caruncle is most commonly recognized in mycotic infections, but may be caused by a variety of bacteria, including Brucella abortus and Salmonella. This is an example of a mycotic placentitis. You can appreciate the changes in the cotyledons, but also there's sort of a leathery thickness to the rest of the placenta as well. And this diffuse thickening of the placenta, I think, is characteristic of mycotic infections of the placenta. Okay. This is Campylobacter placentitis, where you see necrosis of the placentomes. This is adventitial placentation. And adventitial placentation is commonly seen in cows with hydrolantose, but it's a replacement when they've had lesions or damage to the normal placentomes. The placentation is a mechanism of compensation for inadequate development of the placentomes. This is contagious enzootic bovine abortion. You can see multifocal hemorrhages of the tongue, the gingiva, and the lips. Again, bovine enzootic abortion. You get chronic congestion and therefore this nodularity of the liver in the fetus, which is fairly typical of this disease. We'll look at some examples of mastitis next. Streptococcus agalactia used to be the important, but now that we've had antibiotics that respond to that, some of the others, actinomycosis, staph, and nocardia, can be important causes of mastitis in cattle. This is an example of mastitis caused by nocardia. Here we have a purulent mastitis caused by Actinomyces pyogenes. More typically, Actinomyces pyogenes causes a necrotizing suppurative galactophoritis with the primary involvement of the teat canal. You can get in slight involvement of the acinin tissue. Actinomyces pyogenes has been called summer mastitis. It's usually associated with a mix of organisms, and it can affect a non-lactating gland. Staphylococcus can cause a variety of appearances in mastitis, one of which is bacteriomycosis, where you have a persistent foci of the staph with a granulomatous mastitis, and you can see the sulfur granules in these. It's typical of bacteriomycosis. Staphylococcal mastitis can also result in a gangrenous form of mastitis. It usually affects the teat first and adjacent portions of the udder. And you'll see this blue-black discoloration of the udder. The third form of mastitis that you can see with Staphylococcus infection is a purulent mastitis. Here you can appreciate some necropurulent tracts in the udder. And again, a purulent mastitis due to staph. Next, we'll go to some lesions of sheep and goats affecting the heart. And we've discussed some of these that are similar to the lesions that we saw in cattle. This is an example of myocardial steatosis. You can appreciate the lighter areas of discoloration in the heart due to fat deposition. This is Cysticercus ovis. You can appreciate these granulomas in the heart. The cysticercia of Taenia ovis are found in the myocardium. The definitive stage of the organism resides in the gastrointestinal tract of dogs and wild carnivores. Again, I think you can appreciate, sometimes you'll be able to see cysts, but these are actually more granuloma formations here due to the parasites. Hydropericardium can be seen with any cause of hyperproteinemia in sheep and goats, and a typical cause would be parasitism. Hydropericardium with hemorrhage is also seen in Black's disease, and that's caused by Clostridium novii spores. You get a latent infection in the histiocytic cells in the spleen and in the liver And then fasciola hepatica, the liver fluke, causes necrosis. The latent spores vegetate, and you get release of 3 potent exotoxins, alpha, beta, and zeta. And with the damage to the vasculature, you can see this profound hydropericardium with hemorrhage. This is another example of hydropericardium due to Black's disease. Hydropericardium and multifocal hemorrhages. This is a pericarditis. In the sheep, this would be a diffuse fibrinopurulent epicarditis and pericarditis. Fibrinous pericarditis in adult sheep is usually caused by pasteurellosis. In lambs, pasteurella or streptococcal infections can cause. And again, this is a fibrinous epicarditis. This is a rhabdomyoma present in the heart muscle. Next, we'll go to lesions of the skin in sheep and goats. This is cutaneous lymphoma. Now, lymphoma in sheep and goats, even though they have an endogenous retrovirus, the endogenous retrovirus of sheep and goats has never been shown to be causative of malignant lymphoma, but rather all the experimental cases and all the sporadic cases that have been evaluated are positive for bovine leukemia virus. So it's the causative agent of malignant lymphoma in sheep and goats. This is vesicular stomatitis. You see erosions that begin at the commissures of the lips. And vesicular stomatitis will also cause erosive and ulcerative lesions of the teats. This is contagious eczema or contagious pustular dermatitis. It's caused by peripox viral disease. It affects sheep and goats. Morphologic would be a focal proliferative dermatitis. Again, you can appreciate the proliferative lesions around the muzzle and also under the eye. And the skin, occasionally you'll see the proliferative lesions as well. This is alopecia due to scrapie. Primarily you see the pulling of the wool in areas where they can scratch against fences or whatever. So typically the alopecia will be around the hips and on the trunk. Dermatophilus congolensis causes lesions on the skin of sheep and goats, just as it does in cattle. When it's in the wooled areas, it's been called lumpy wool disease. In the digestive tract, this is a very classic lesion here. There's a chronic multifocal granulomatous esophagitis. It's due to esophageal sarcocysts. They're ovoid, white, thin-walled nodules, up to 1 centimeter long, and they project from the esophageal muscle. Etiology is Sarcocystis gigantea, and it's spread by cats. An etiologic diagnosis would be esophageal sarcocystosis. This is an example of necrotizing ruminitis in a sheep. This could very well be mycotic ruminitis. You see the hyperemic rim and areas of infarction. This is omasum, multifocal necrohemorrhagic omasitis caused by blue tongue virus infection. In the abomasum, any cause of hyperproteinemia, typically you'll see profound edema in the abomasum in sheep and goats. This is a chronic multifocal proliferative abomasitis due to osteotagiasis. Just as in cattle, it causes the metaplasia in the mucosa, forms the proliferative nodules. Again, this nodular appearance to the abomasal mucosa is very typical for osteotagiasis. This is Homunculus contortus, the barber pole worm in the abomasum. It's a large blood-sucking trichostrongyle and can cause severe anemia and hyperproteinemia in sheep and goats. You can appreciate the acid hematine-tinged contents from the hemorrhage. And you can see sort of the striping of the worms, the red and white, that gives them the name of the barber pole worm. In the mesentery, you can appreciate one of the cysts of the tapeworms, the Cysticercus teniacolus. This is coccidiosis in sheep and goats. Now in cattle, you remember we had a more diffuse necrotizing enteritis. But in sheep and goats, Eimeria form grossly visible plaques in the mucosa in the distal small intestine and occasionally in the large bowel. Eimeria forms hypertrophic cryptvillous units where almost every epithelial cell in an area will be infected by the primary gametocytic stages of the coccidia. And then adjacent to that area, you'll have perfectly normal mucosa that's unaffected. So it almost gives you like a granulomatous type appearance. But it's a proliferative change in the intestine. So a morphologic diagnosis when you see this type of appearance in the intestine of a sheep or a goat would be chronic, diffuse, proliferative, or pseudoadenomatous enteritis. These nodules are visible from the serosal surface due to the marked mucosal hypertrophy. And this is another example of Eimeria or coccidia in the small intestine. Lesions of ovine and caprine skeletal muscle. The sarcocystis are grossly visible in the musculature. And a typical thing for orientation with sarcocystis, if you want to differentiate that from cysticercus, the sarcocystis, they're oval, more elongate shape, and they also follow the lines of the muscle fibers. They're orientated with the muscle fiber. Whereas cysticercus is more rounded and doesn't appear to be affected by the muscle fiber orientation. It just crosses the fibers, and these granulomas actually replace areas of the skeletal muscle. This is Cysticercus ovus. Might be called muscular cysticercosis, would be an etiologic diagnosis. Liposarcoma has been reported in the musculature, neck muscles of a sheep. And this is an example of white muscle disease in goats, whereas in cattle you'll see white, multiple areas of streaking in several muscle groups in cattle. In sheep and goats, many times it'll affect selectively muscles. This muscle is perfectly normal. This one, the whole muscle is diffusely involved by skeletal muscle degeneration and necrosis. So it's a little bit different appearance grossly. Next we'll look at ovine and caprine kidney and urinary bladder lesions. This is a suppurative pyelonephritis. You can see the irregularities to the calyces or the pelvis, and purulent material here, and infection going up through the medulla into the cortex. You also have another morphologic diagnosis here. These are multifocal cortical areas of infarction. And here, these are older areas of infarction, so they're dehemoglobinized. So they're not just straight red like you'd have in a hemorrhagic acute infarct, they may be of a day old. So this would be suppurative pyelonephritis with multifocal cortical renal infarcts. These are multiple abscesses in the kidney due to corynebacteria. This is hemoglobinuric nephrosis. or copper toxicosis. This is a more normal kidney, and here you can appreciate the dark discoloration due to the hemoglobin pigment. Of course, a myoglobin area would cause the same lesion, but because of the exquisite susceptibility of sheep to copper toxicity, hemoglobinuric nephrosis would be on the top of my rule-out list with this type of appearance of the kidney. Again, hemoglobinuric nephrosis. This is malignant lymphoma in the kidney of sheep. Sheep and goats also get the renal cysts, as we saw, similar to those in cattle. And sheep, polycystic kidney disease has also been described in sheep. Here you can see you've got multiple small cysts that affect the medullary area and also the cortex. This is cloisonné kidney in the goat. It's a non-clinical condition. The renal cortices are uniformly brown or black due to thickening and pigmentation of the basement membranes of the proximal convoluted tubules. Ferritin and hemosiderin are deposited here due to endovascular hemolysis. So this is cloisonné kidney. This is renal lipidosis in cattle, sheep, and goats, the proximal convoluted tubules. Many times these epithelial cells will become filled with lipid vacuoles. That's what gives you this sort of stipple pattern in the cortex. Again, renal lipidosis. This is cholemic nephrosis. We get an orange discoloration of the kidney. This is an example of chronic interstitial nephritis. In the kidney, you see the lumpy, bumpy pitting of the capsular surface due to fibrosis. And on cut surface, again, you can appreciate the irregularities of the capsular surface. And then you can see the rays of fibrosis that extend from the capsular surface through the cortex and down into the medulla. That's chronic interstitial nephritis. Sheep and goats also are affected by urolithiasis. There's a genetic basis in sheep. Apparently, sheep can excrete phosphorus in urine or more commonly in feces, but of course the sheep that excrete phosphorus in the urine are much more predisposed to have problems with urolithiasis. Urolithiasis can contribute to obstruction of urinary outflow. And of course, this is an example of hydronephrosis and also hydroureter. You can appreciate the atrophy of the renal medulla and thinning of the cortex. Here you can see where there's been obstruction of the urethra and ischemic necrosis of the mucosa, secondary to urinary calculi. This is a normal urethral process in a goat, and many times the urethral calculi can become trapped in this area. This is melanoma of the bladder. Next, we'll discuss lesions of sheep and goat liver and gallbladder. Telangiectasis is common in the liver of sheep and goats as well, sawdust liver. You can see this is diffuse hepatic lipidosis. It's associated with ketosis or pregnancy toxemia, many times in sheep and goats. Here you can appreciate the liver is swollen, enlarged, rounded edges, lighter in color. This is diffuse hepatic lipidosis. As you can see, you've got another morphologic, this dilated gallbladder. You often see the dilated gallbladder with anorexia in ruminants. So this is probably hepatic lipidosis secondary to starvation, anorexia, or pregnancy toxemia. With copper toxicity, you'll have icterus, which provides a yellow color to the liver. And in sheep, you also have acute hemolysis, which gives you a red color from the hemoglobin. So you'll see diffuse orange coloration to the liver in copper toxicity in sheep. Sheep have a limited ability to excrete copper in the bile, So as a species, they're more prone to copper toxicity. In other words, toxic amounts of copper can accumulate in the liver of sheep, while dietary copper levels are not excessive for other species. You can see copper toxicity in cattle and pigs, but it's due to abnormally high intake of copper. Corynebacterium pseudotuberculosis, the causative agent of caseous lymphadenitis, commonly causes abscesses in the liver. Again, you can see chronic pyogranulomatous multifocal hepatitis. Liver flukes are also common in sheep and goats. Just a few Fascioloides magna can kill a sheep. Here you can appreciate where they've had these large migrating tracts. So you have a multifocal coalescing necrotizing hepatitis with deposition of iron porphyrin pigments and fluke infestation. Next, we'll take a look at cestode infestation of the liver. This is Cysticercus tenuicollis. And if you get a cross section like this where you can see the internal structure, of course that's pathognomonic for Cysticercus tenuicollis. These are the acute migratory lesions, and lambs can die of severe hemorrhagic hepatitis caused by heavy infestations of this parasite. And again, this would be a multifocal necrohemorrhagic hepatitis due to the migrating larvae of Cysticercus tenuicollis. This is Thysanosoma actinoides, or the French tapeworm. It lives in the bile ducts of the liver and can also be found in the gallbladder, as this one is. This is hemangiosarcoma of the liver. You can see hepatocellular adenomas and carcinomas of the liver. Similar texture as the liver parenchyma, usually lighter in color. They can be pink or more a yellow color. This is Black's disease caused by Clostridium novyi. Clostridium novyi is widely distributed in the soil. The spores are ingested. They remain as a latent infection in histiocytic cells in the liver, the spleen, and in the bone marrow in sheep. But you only get disease with migration of the liver flukes. So distribution of this disease occurrence is more dependent upon the liver fluke Fasciola hepatica. It's very typical to see these yellow-white circumscribed areas in the liver, these areas of necrosis. Then you also look for areas where you see sort of the black tracts that represent the migration of the liver fluke, and that's Black's disease. This is sort of a classic lesion. This is the liver from an aborted fetal lamb, and you see these target lesions. Those are very characteristic of Campylobacter fetus variety intestinalis. It causes abortion in sheep. Necrobacillosis, or hematogenous areas of infarction due to Fusobacterium necrophorum, can also be seen in sheep and goats, just as they are in cattle. You can see the lungs here, the heart, and this large mediastinal mass. If you saw this mass in cattle, my first rule out would be malignant lymphoma, or thymic lymphoma. But thymic lymphoma is not that common in sheep and goats, but thymomas are very common, or one of the more, I guess, of the species that thymoma is common in goats would be one of the few. And that's very typical to have a very thick capsular covering to the thymoma. Here you can appreciate a fibrinous pleuritis and pericarditis. In sheep and goats, this is typically caused by Pasteurella hemolytica, usually biotype A in sheep and goats. In the nasal sinuses and turbinates, many times you can see a catarrhal rhinitis secondary to estrus ovis, the nasal bite of sheep. Endemic nasal adenocarcinoma has been described in sheep. Retrovirus C-type particles have been found in tumors from sheep and goats on electron microscopy. This is another example of nasal adenocarcinoma. And also squamous cell carcinomas can be found in the nasal cavity of sheep and goats. This is atelectasis due to lateral recumbency. Here you can appreciate multifocal hemorrhages in the lungs. This is a goat with urea toxicity. Here we have aspiration pneumonia. Appreciate consolidation of these areas of the lungs. And now we'll talk about interstitial pneumonias of sheep and goats. Morphologic diagnosis for this would be chronic, severe, diffuse, interstitial pneumonia. This is ovine progressive pneumonia, if you were asked to name the disease. It's caused by the Medivacina virus of the lentivirus subfamily of retroviruses. You can appreciate there's a very smooth, homogeneous appearance to the cut surface of the lung. This is a proliferative pneumonia. Again, ovine progressive pneumonia. Very meaty appearance to the lung. Alveolar cells have proliferated to completely fill the air spaces. This lung will not collapse. This is an example of pulmonary carcinomatosis, or ovine adenomatosis adenocarcinomatosis. It's more nodular. You can appreciate the nodularity to this lung disease. It's also an interstitial pneumonia. It's an infectious form of bronchoalveolar tumor, and it has the behavior of a low-grade carcinoma. Ovine pulmonary carcinomatosis is caused by type BD retrovirus. This is pulmonary carcinomatosis. You can appreciate more the nodularity here, proliferations of the epithelial cells. And again, ovine pulmonary carcinomatosis. This is interstitial pneumonia in a goat, and the cause of this is caprine arthritis encephalitis, and it causes a chronic, severe, diffuse interstitial pneumonia that's histologically very similar to the ovine progressive pneumonia. And in fact, the etiologic agent, the Lynda virus, is anagenically very similar to the virus that causes ovine progressive pneumonia. And we know more about the arthritis and encephalitis of this disease. The pneumonia has not been quite as well studied. This is an example of an embolic mycotic pneumonia. You can appreciate here some of the lesions in the intestinal tract that may have contributed to hematogenous spread of the mycotic etiologic agent. This is a multifocal granulomatous pneumonia due to Mycobacteria bovis. Melanosis is common in the lungs of sheep and goats, just as it is in cattle. These are some examples of bronchopneumonia in sheep and goats. This is a sheep with Pasteurella multocida. And again, you can appreciate the enteroventral distribution with Pasteurella. Here we have Pasteurella, enteroventral distribution in a goat. And here you have some associated pleuritis as well with Pasteurella hemolytica. This fibrinous pleuritis and pneumonia is caused by hemolytic strep in a goat. Here we have lungworms, verminous pneumonia. A morphologic diagnosis for this would be mucoid bronchitis and bronchiectasis with interlesional nematodes. And this is Dictyocollis filaria, which is the lungworm of sheep and goats. Dictyocollis viviparus was one of the lungworms in cattle. The adults live mainly in the small bronchi, and typical lesions would be bronchopneumonia in the dorsal caudal region of the caudal lung lobes. Protostrongylus is another cause of lungworms in sheep and goats, and the lesions are very similar to these caused by Dictyocollis. Mularis is probably one of the more common ones, and it's called a nodular lungworm because it causes nodules in the subpleural areas of the lung. A morphologic diagnosis would be a multifocal interstitial pneumonia. The adults live in the parenchyma and cause an enveloping granulomatous response. So this is caused by Mularis. These areas of dark discoloration here are caused by liver fluke migration and deposition of the iron porphyrin pigments. There, I think you can appreciate here that you've got a multifocal, necrotizing and hemorrhagic pneumonia due to the liver flukes. This is a classic. We've got multifocal necrotizing placentitis. Following experimental infection of Toxoplasma gondii into pregnant ewes, parasitemia occurs within 3 to 4 days. The organism first goes to the caruncle, then to the trophoblasts in the fetus. The organism multiplies in the caruncular septa, producing foci of necrosis. So the gross lesions are almost invariably limited to the cotyledons. You'll see focal 1 to 2 millimeter yellow to white areas in the villus. The lesions are more easily observed by placing the cotyledons in saline. I think you can appreciate areas of necrosis here. So this is Toxoplasma gondii infection. This is Brucella ovis, and unlike Brucella abortus in the bull, you don't have a primary orchitis. See here, the testicle's pretty normal. So in cattle with Brucella, you'd have a granulomatous orchitis and epididymitis. But in sheep with Brucella ovis, you don't have the orchitis, but you do have a pronounced epididymitis, and the 80% of them, the majority of the lesions in the tail of the epididymis. It's much more severe. Again, here you can see the epididymitis due to Brucella ovis. This is an example of gangrenous mastitis or blue bag. You can appreciate here you've got a diffuse, necrotizing and hemorrhagic mastitis. And this is a purulent mastitis. This is hydrometra, dilatation of the uterine horns and body with a proteinaceous fluid. Pasture legumes are a source of estrogenic activity. It causes problems with infertility in sheep. You get an endometrial hyperplasia and production of the proteinaceous fluid. It's called clover disease. So this is hydrometra of the uterus. Next we'll look at lesions of ovine and caprine bones and joints. Causes of arthritis in cattle in the neonates would be Streptococcus and E. coli. Also you get arthritis in cattle with Actinomyces pyogenes, Salmonella, Mycoplasma bovis, and Haemophilus somnus. In sheep, causes of infectious arthritis in lambs would include Streptococcus, Haemophilus agni, staph, chlamydia, and erysipelas. In adult sheep, you'll see Mycoplasma causing a proliferative synovitis. In goats, the retrovirus of caprine arthritis encephalitis, you'll see arthritis, and also Mycoplasma is a problem. This arthritis, you can see, is a chronic pyogranulomatous. It's caused by Corynebacterium pseudotuberculosis. These are lesions of caprine arthritis encephalitis. You'll get a fibrinopurulent arthritis. I don't have a picture of it, but also there's a high prevalence of carpal hygromas in goats with CAE. It's caused by a persistent infection with the non-oncogenic retrovirus or lentivirus. And the related lentivirus of sheep, ovine progressive pneumonia virus, also causes arthritis in lambs. Again, this is CAE in the goat. This arthritis is caused by mycoplasma. They'll get a severe fibrinopurulent arthritis, and usually many of the synovial structures will also be involved. Here you have a fibrinopurulent arthritis, polyarthritis, and you'll see this in many causes of septicemia in lambs and goats. The estrus ovis larvae can migrate out of the nasal sinuses and actually come to the base of the brain and can cause areas of hemorrhage, necrosis, and abscessation with clinical signs. This is porencephaly, cystic cavitation of the brain, loss of white matter of the cerebral hemispheres. Causes in sheep and goats would include Alcobani disease, Cache Valley fever, blue tongue. In lambs and calves you'll see this, and border disease. Of course, BVD also causes this in cattle. Sheep also have squamous cell carcinoma of the eye. This is a cyclopean fetus. Cyclopia is caused by damage to the prosencephalon prior to the outgrowth of the optic vesicle. There's improper separation of paired midline structures. You can also see this in Jersey and Guernsey cattle that have the prolonged gestation syndromes. In goats, you'll see this. In sheep, you'll see this with ingestion of Veratrum californicum at the 14th day of gestation. If you open up the eye many times, you'll have some duplication of intraocular structures such as the lens and the iris, and then it's more correctly called synophthalmos. Goiter can commonly be seen in sheep and goats. This is bilateral hyperplastic goiter. The thyroid glands of the young are exposed to higher blood iodine levels than adult sheep because the placenta concentrates iodine, and also the mammary gland does as well. Now, hyperplastic goiter in lambs can be caused by an iodine deficiency, marginal iodine in the diet, plus goitrogenic compounds, and also the excess iodine. You can also get bilateral colloid goiter in sheep and goats, which represents the involutionary phase of the hyperplastic goiter. This is a normal lymph node from a sheep. You can appreciate here the separation of the cortex from the medullary area. This is accentuated in reactive hyperplasia. So this is lymph node reactive hyperplasia. The lymphoid follicles are expanding the cortex. This is malignant lymphoma of the lymph node. You've lost this architecture that's normally present in the node. This is an example of caseous lymphadenitis. It's caused by Corynebacterium pseudotuberculosis. There's progressive necrosis and reformation of the abscess capsule. That gives these abscesses their characteristic concentric lamellations. Eosinophils give it the green discoloration. You can also have lesions due to Corynebacterium pseudotuberculosis in the mammary gland, causing bronchopneumonia, and also causing abscesses in the kidney, liver, and spleen. Here you can appreciate the concentric lamellar structure that you see in caseous lymphadenitis. That's a classic, and you should be able to recognize this grossly as caseous lymphadenitis. And occasionally they will have more the appearance of a typical abscess lymph node. This is granulomatous lymphadenitis caused by Mycobacterium bovis. This is a normal spleen of a sheep. Here you can see reactive hyperplasia where the lymphoid follicles are enlarged but evenly spaced throughout the spleen. Here you have marked enlargement of follicles but not evenly spaced, and this is malignant lymphoma in the spleen. Abscesses are commonly seen in the spleen of sheep and goats. These abscesses are caused by Actinomyces pyogenes. So this would be a multifocal pyogranulomatous